Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 9 homeopathic remedies for splenomegaly. What is splenomegaly? Spleen is an organ which is harbored in the left side of our rib cage. Note this picture. There is left side of the rib. Inside this rib cage, spleen is lying inside. There are many situations, for example, infection, cancer, or liver diseases, when it gets bigger and larger in size. This situation is called splenomegaly. That is, spleen enlarged. It is very difficult to palpate in healthy condition. That is, palpation is a clinical term. Doctors actually likes to palpate the organ beneath our mainly abdominal cavities, say liver, spleen, stomach, and then pancreas, and by their hand. You might have noted that they are pressing your abdomen with their fingers and hands. This is called palpation. Now this palpation of this particular organ is very, very difficult because it is in such a position that palpation is not possible. What are signs, symptoms of splenomegaly? An enlarged spleen very often may not present any symptoms. It may be symptomless. However, it sometimes may show the following symptoms: fullness, heaviness in the left upper belly that reaches left shoulder. That is, the fullness, sensation of fullness reaches to the left shoulder above. Feeling of fullness in stomach after eating a small amount of food, because since this is enlarged, so this is giving pressure on stomach. Just it is beside stomach, so stomach is filled up easily. Often receiving infection. That is, when splenomegaly is there, the person is receiving easy infection. Anemia or low RBC count. Certainly, when spleen is in trouble, RBC will be less and patient will be suffering from anemia. Scattered bleeding on body surface also, because this particular organ controls the bleeding time, PT. Naturally, this symptom will be there. What functions a spleen usually perform? Following important functions are performed by a spleen: destroying old damaged blood cells, storing red blood corpuscles and platelets, acts as a first line of defense against any disease causing agent. Whenever some disease causing agent enters into our body, they are the first to act. First line of defense. Preserve iron during RBC aging degeneration. That is, sometimes RBC has got only 120 days lifetime. After each 120 days, a RBC dies. When it dies, the RBC contains most important globin portion and also heme portion. The heme portion contains the iron. That iron is preserved so that it can be reutilized. That is preserved by spleen. When the RBC is aging, degenerated by aging. What are causes of splenomegaly? All microbial infections. Mind it, microbial infection means virus, bacteria, parasitical, any type of microorganisms. Any type of microorganisms which causes infection is called microbial infections. Liver diseases. Mind it, liver disease is directly related to splenomegaly. Hemolytic anemias. For various reasons, the blood RBCs disintegrates. These are called hemolytic anemias. There are so many causes. Most important cause is some poisonous thing, say snake venom or this type of any venom or any poisonous substance enters in their body, the RBCs disintegrates. That is called hemolytic anemias. Blood cancers or lymphomas. Few metabolic disorders like gouters, etc. Autoimmune diseases like lupus, rheumatoid arthritis, etc. On the right hand side, I have collected a pamphlet from internet and have directly just put up here. The spleen functions: produce lymphocytes that aid our immune system, produce antibodies, remove old damaged blood cells, act as a reservoir of blood in times of shock and hemorrhage, that is when we need blood at the time of necessary. This particular organ supplies the extra blood, preserves iron during filtration, important for synthesizing hemoglobin, that is for future. Almost this thing same, but this is collected from some else, technical books or medicine books of medicines, but this is not medicine book, this is collected from internet. But basically both the things are same. Here also you see this is the placing of spleen. Is spleen an indispensable organ? No, it is not an indispensable organ. Nevertheless, it is an important organ. That is, one may live a healthy life without a spleen, but in that case, one has to take a few more precautionary steps to avoid infection. Because in the first hand, spleen protects us from those type of infection. So you have to be careful about those special types. How to maintain a good spleen health? Now here we will see what are the points. It is difficult to maintain good health of the spleen because spleen is the first to react. So you cannot prevent completely. It will automatically go to fight the infection, and while fighting the infection, it is damaged itself. It damages itself. But there are a few preventable steps to avoid splenomegaly, such as avoiding of things of personal effects with others. Personal effect means your personal things, maybe mostly your personal utensils, your personal dresses. These are the things. While playing outdoor games, wear protective gadgets to prevent injury to spleen. Injury to spleen is very common event for splenomegaly. Use condom while having sex with an unknown person. It's most common thing, everybody knows. Wear seat belt while driving car. This may not be done by many persons, but this should be done as a routine work. Drink alcohol in moderation, means 1 peg a day for female, 2 pegs a day for male. Get regular vaccination for or against the following: Haemophilus influenza or flu, meningitis, TDAP, that is tetanus, diphtheria and pertussis. Tetanus, diphtheria and pertussis. MMR is measles, mumps and rubella. And singles or chicken pox or HPV. These are very, very common types of vaccinations. These are not all vaccines. There are some name of the disease. In that case, you have to take the vaccination for that disease. But there are directly some name of the vaccines. That is TDAP, MMR. These are direct vaccines. So you have to take all these, and these are most common thing available. If you are interested, you contact your doctor. Doctor will arrange to give you these things. No matter. Schwannomas for splenomegaly. Aching in umbilical region. Umbilical region. This is umbilical region. On the right hand side, I have shown the abdominal 9 quadrants. This particular picture I have shown in so many videos. I will show in future also. Clay colored stool, soft pasty, jaundice, tongue heavily coated, appetite lost. During stool, cold sweat on forehead and back of the hand. Give mother tincture. M means drop, V means 5. 5 drop, 3 only. Agaricus for splenomegaly. Needle-like pain in spleen area. Spleen area means left hypochondrium area. Profuse inodorous hot flatus. Eructation alternates with hiccup. Give 3, that is agaricus 3, 4 hourly. Urtica urens for splenomegaly. Stinging or burning pain in the left hypogastric region, that region for specific region for the spleen. Intermittent fever with enlarged spleen. Give 3, that is urtica urens 3 hourly. Arsenicum for splenomegaly. fever with intense weakness, restlessness, fear of death, thirst for a sip of water again and again. Give 3, arsenic 3, 2 hourly. Cyanide for splenomegaly. Flatulent bloating. Abdominal colic better from bending double. Splenomegaly with extreme weakness from long suffering from fever. Thirst for cold water which worsen the diarrhea. Give China 6, 2 hourly. Natrium salt for splenomegaly. Persons of bilious diathesis desire for ice and ice cooled water. Incarcerated flatulence. Incarcerated flatulence means, flatulence you know, it's wind. Incarcerated means it is locked. It is neither going up nor going down. It is locked in the intestine. That is a very painful situation. This type of flatulence. Involuntary stool while passing flatus. Keep 6, that is natrium salt 6, 4 hourly. Carduous for splenomegaly. Stitches near splenic region, that is left hypochondriac region. Worse on inspiration or stooping. Hard, difficult, knotty, clayey stool. Hemorrhagic piles. Note this, piles, hemorrhagic piles. Give mother tincture. Give mother tincture 5 drop. M means minim, minim means drop. 5, V means 5. 5 drop mother tincture 3 hourly. Natrium mure for splenomegaly. Splenomegaly after too much use of quinine. Sweat on face while eating. Chronic painless diarrhea in morning. Patients crave or abhor. Abhor means dislike. Table salt. You know, natrium mure, most of you know that natrium mure want to take more and more salt, but it has also a tendency to avoid that. That is also natrium mure. So that is avoid table salt. Give 6, natrium mure 6, 4 hourly. Sulfur for splenomegaly. When well selected remedy fails, stitches in splenic region worsen during deep inspiration or coughing. Sensation as if something alive in the abdomen. Give sulfur 30, 4 hourly. With this the video ends. Thanks for listening and viewing. If you got anything to say, please write in the comment section. I would certainly respond.